Hello, Dr. Eva Fisher here, and I am on to part 3 of my How I Recovered from Body Dysmorphic Disorder story. Where I left off is I had just picked up this Shape magazine from 1997 that I had seen when I was standing in line at a grocery store after having moved to Boulder, Colorado when I was 30 years old. What I wanted to talk about next was the contents of the magazine. So inside the magazine was an article by Liz Brody about body dysmorphic disorder. The article described the symptoms, possible causes, and treatment for the disorder. There was a 5-item self-diagnosis questionnaire and a list of 10 common symptoms of the disorder from the book, The Broken Mirror, Understanding and Treating Body Dysmorphic Disorder by Dr. Catherine Phillips, who is a pioneer in the field of research into body dysmorphic disorder. She has been researching the condition for more than 30 years. And The Broken Mirror is a seminal, groundbreaking book that was written in 1996 by Dr. Phillips about this condition, body dysmorphic disorder, that was very few people knew about body dysmorphic disorder at the time. I think it is still under-recognized by a lot of physicians and a lot of people with BDD, unfortunately, like me, when I had it, have what's called the delusional variant of BDD, meaning that I had really no insight or knowledge that I had body dysmorphic disorder. I really believed that what I saw in the mirror was real, was how I actually looked, despite, as I said, my friends and family members and past boyfriends telling me that I looked fine. Past boyfriends even told me I looked beautiful, and I didn't believe any of it. I really believed that what I saw in the mirror was real until I read this article. The article discussed effective treatments, both pharmacological, meaning medical medicine, like SSRIs, such as Prozac, and clinical, like therapy, and noted that cosmetic surgery is often ineffective in treating symptoms of the disorder. Sufferers described feelings of shame and embarrassment that were incredibly familiar to me. Dr. Phillips took composites from her patients and described their suffering and their symptoms and their experiences. And those are what I really resonated with. Along with the questionnaire, it really allowed me to say, wow, these people sound just like me. They're going through what I'm going through. Also, as I was reading the article, I was relieved to read that those with people with the disorder are often considered to be quite attractive, even while believing they are ugly. This reassured me that my friends and family members were telling me the truth, rather than just trying to make me feel better by saying that I looked fine to them. I want to say I am forever grateful to Dr. Catherine Phillips for her research and others who actually have done research along with her on the topic of body dysmorphic disorder, because that article and reading about the condition absolutely changed my life. Now I had a name for what I had been suffering from since I was 16 years old. Now I knew that Prozac could help me. I felt empowered by this information, and for the first time in almost 20 years, had hope that I really was not as ugly as I imagined myself to be. The article provided me with the insight and information I needed to diagnose myself with the disorder. However, the realization that I was not really seeing myself the same way others did was shocking at first. I was both relieved and dismayed by the possibility that what I saw in the mirror was not what others saw when they looked at me. The stigma regarding having a mental health condition was less important to me than the stigma and shame that I felt regarding my perceived appearance defects. As a result, I referred myself to treatment. I do want to mention, before I talk about the treatment I received for body dysmorphic disorder, that it really is important to have the courage to come forward. If my recovery story and the symptoms that I'm describing are things that make sense to you, that resonate with you, have the courage to come forth and get the help that you need so that you too can recover from this really terrible, debilitating mental health disorder known as body dysmorphic disorder, or BDD. I will come back and continue my story talking about the treatment that I received for body dysmorphic disorder in part 4. Thank you.